Have you ever looked down at your feet and noticed something different? Maybe they seem puffier than usual, your socks leave deeper marks, or your shoes suddenly feel tighter? It's easy to blame aging, warm weather, or simply being on your feet all day. But sometimes your feet can quietly reveal changes happening inside your body long before you notice other symptoms. One of the organs that may send these early signals is your kidneys. These two bean-shaped organs work around the clock to filter waste, balance fluids, regulate minerals, and help control blood pressure. The surprising part is that kidney problems often develop slowly. In the early stages, many people feel completely fine. That's why paying attention to subtle changes, especially after the age of 60, can make a real difference. Before we begin, if you enjoy learning simple, evidence-based ways to stay healthy and independent as you age, consider subscribing. We share practical health information designed to help you make informed decisions, one step at a time. And as we go through today's topic, I'd love to know your age and where you're watching from. Our community includes viewers from all over the world who are committed to healthy aging. Now let's talk about why your feet deserve more attention than they usually get. Your kidneys filter around 50 gallons of blood every single day. They remove extra water, waste products, and help keep the right balance of sodium, potassium, and other important minerals. When they're working well, you probably never think about them. But when their function begins to decline, even gradually, your body may start sending small warning signs. One of the earliest places these signs can appear is your feet and ankles. Why there? Gravity plays a big role. Throughout the day, fluids naturally move downward. Healthy kidneys help your body remove extra fluid through urine. But if the kidneys aren't filtering as effectively, fluid may begin to build up in the tissues, especially in the lower legs, ankles, and feet. That doesn't automatically mean someone has kidney disease. Swelling in the feet can also be linked to heart conditions, vein problems, certain medications, liver disease, standing for long periods, or even a recent injury. The important point is this: persistent or unexplained swelling deserves medical attention rather than being dismissed as just getting older. And there's another sign many people overlook that we'll discuss shortly. It's so common that thousands of older adults ignore it every day without realizing. It could provide valuable information about their health. Let's start with the first sign. Swollen feet or ankles, also called edema, happen when excess fluid collects in the body's tissues. You may notice your shoes fitting differently by evening. Socks might leave deep impressions around your ankles. Your feet may appear shiny or feel unusually tight. Sometimes pressing a finger gently against the swollen area leaves a small dent that slowly fills back in. Healthcare professionals call this pitting edema. Again, swelling alone doesn't diagnose kidney disease, but if it develops without a clear reason, keeps coming back, or gets worse over time, it's worth discussing with your healthcare provider. They may recommend simple blood and urine tests that provide valuable information about kidney function. Imagine two neighbors in their 70s. Both notice mild ankle swelling after dinner. One assumes it's simply because of age and ignores it for months. The other mentions it during a routine checkup. After a few straightforward tests, the doctor identifies reduced kidney function early. That early discovery allows for lifestyle changes, careful monitoring, and treatment that may help slow further decline. The difference wasn't dramatic symptoms. It was paying attention to a small change. Here's something many people don't realize. Kidney disease is often called a silent condition because symptoms may not become obvious until significant damage has already occurred. That's one reason regular health checkups become increasingly important after age 60, especially if you have diabetes, high blood pressure, or a family history of kidney disease. In a moment, we'll talk about another sign that often appears alongside swelling, but it's something many people mistakenly blame on tiredness or poor circulation. Before we move on, remember that your kidneys and your heart work closely together. A problem affecting one can sometimes affect the other. That's why healthcare providers usually look at your overall health instead of focusing on just one symptom. The next sign involves changes in the skin on your feet and lower legs. Healthy kidneys help maintain the balance of minerals and fluids your body needs. When kidney function changes, some people notice their skin becoming unusually dry. Others experience persistent itching that isn't explained by allergies, insect bites, or dry winter. Air, This kind of itching can be frustrating because creams may provide only temporary relief. Why does this happen? As kidney function declines, waste products and changes in mineral balance may affect the skin. There are also changes in moisture levels and nerve function that can contribute. It's important to know that dry skin has many possible causes, including aging itself, certain soaps, weather conditions, dehydration, and skin disorders. But if persistent itching develops alongside swelling, fatigue, or other concerning symptoms, it's another reason to speak with a healthcare professional. Think about how often people buy a stronger moisturizer without asking why their skin has changed. Sometimes that's all that's needed, but occasionally the skin is quietly encouraging us to look a little deeper. This is why doctors often emphasize patterns rather than isolated symptoms. One small change may not mean much. Several subtle changes occurring together deserve more attention. Here's another interesting fact. Many people assume kidney disease always causes pain in the lower back. In reality, chronic kidney disease usually develops without causing kidney pain. That's one reason it can remain unnoticed for years. Instead, the body may reveal much quieter clues, including those appearing in the feet. Coming up next, we'll explore one of the most overlooked changes that can affect the feet before many people ever think about their kidneys. It isn't swelling, and it isn't pain, but once you know what to watch for, you may never overlook it again. Before we continue, if you found today's discussion helpful so far, consider subscribing so you don't miss future videos about healthy aging, heart health, brain health, mobility, and practical ways to stay independent. Every week, we focus on information that can help you have more informed conversations with your healthcare team. Now let's continue with another change that many people overlook because it develops so gradually. Some people begin to notice numbness, tingling, or a pins and needles feeling in their feet. Others describe it as wearing invisible socks even when they're barefoot. At first, the sensation may come and go. Over time, it may become more noticeable, especially at night. There are many possible causes for these symptoms. Vitamin deficiencies, nerve problems, poor circulation, certain medications, and diabetes are all common reasons. Kidney disease is another possible contributor, particularly in more advanced stages, because waste products that healthy kidneys normally remove can begin to affect the nerves. The important point is not to assume you know the cause. If numbness or tingling appears suddenly, becomes worse, or is accompanied by weakness, it should be evaluated promptly. Even if it develops slowly, it's worth mentioning during a routine medical visit. Identifying the underlying cause early may allow treatment before the problem becomes more severe. Imagine trying to walk across your living room when your feet no longer give your brain accurate information about where they are. Even mild numbness can increase the risk of losing balance, and after age 60, preventing falls becomes just as important as treating illness. That brings us to another sign that's easy to dismiss. Have you noticed small cuts, blisters, or scrapes on your feet taking longer than expected to heal? Many people assume slow healing is simply part of getting older. While aging can slow the body's repair processes somewhat, wounds that heal very slowly deserve attention. Kidney disease itself can affect healing, especially when it occurs alongside diabetes or poor circulation. Reduced blood flow, inflammation, and changes in the immune system may all play a role. That's why healthcare providers often recommend checking your feet regularly, especially if you have diabetes, high blood pressure, or known kidney problems. A quick daily foot check only takes a minute or two. Look for new swelling, changes in skin color, blisters, cuts, cracks, red areas, signs of infection, changes in your toenails. If bending down is difficult, use a hand mirror or ask a family member for help. This simple habit may help you notice changes long before they become serious. Now here's something that surprises many people. Not every kidney warning sign stays in the feet. In fact, one of the strongest clues often appears in the bathroom. Changes in urination deserve attention. Some people notice they need to urinate more often at night. Others notice foamy urine that doesn't disappear quickly, darker urine, blood in the urine, or producing much less urine than usual. These changes don't automatically mean kidney disease. urinary tract infections, enlarged prostate, medications, dehydration, and several other conditions can also cause similar symptoms. But persistent changes should never be ignored. Simple urine and blood tests can often provide valuable information about how well your kidneys are functioning. This is a good reminder that your body usually tells a story through several clues rather than just one: swollen feet. Changes in urination, persistent fatigue, dry, itchy skin, loss of appetite. These symptoms together deserve more attention than any one symptom alone. Speaking of fatigue, many people think feeling tired is simply part of getting older. While everyone experiences occasional tiredness, ongoing fatigue that doesn't improve with rest can sometimes be linked to declining kidney function. Healthy kidneys produce a hormone that helps your body make red blood cells. These cells carry oxygen throughout your body. When kidney function declines, production of this hormone may decrease, leading to anemia, a condition where the body has fewer healthy red blood cells. Less oxygen reaching your muscles and brain can leave you feeling exhausted, weak, or short of breath during activities that once felt easy. Again, there are many causes of fatigue: poor sleep, heart disease, thyroid problems, depression, medication side effects, vitamin deficiencies. That's why guessing isn't helpful. Testing is. One conversation with your healthcare provider may provide answers that months of worrying cannot. Let's pause for a moment because the next topic is one of the biggest reasons kidney disease becomes more common after age 60. Two conditions are responsible for a large percentage of chronic kidney disease worldwide: high blood pressure and diabetes. High blood pressure places extra strain on the tiny blood vessels inside the kidneys. Over many years, that pressure can damage the kidney's delicate filtering units. Diabetes creates another challenge. Persistently high blood sugar can gradually damage those same tiny filters, making it harder for the kidneys to remove waste while keeping important proteins inside the body. This damage often develops silently. Someone may feel perfectly healthy while kidney function slowly declines. That's why people living with diabetes or high blood pressure should have regular kidney testing, even if they have no symptoms. Routine monitoring allows problems to be identified much earlier, when treatment and lifestyle changes are often most effective at slowing progression. If today's information has been useful, I'd love to hear from you. Have you ever noticed swelling in your feet or ankles? Or have you learned something today that you wish you had known sooner? Share your experience in the comments. Your story may encourage someone else to pay attention to a symptom they've been ignoring. Now, in the final part of this video, we'll discuss practical daily habits that support kidney health, common mistakes many older adults unknowingly make, situations where you should seek medical care without delay, and the key takeaways that can help you protect your kidneys for years to come. Now let's focus on something encouraging. While we can't control every factor that affects kidney health, there are many everyday habits that can support healthy kidneys and your overall well-being. These habits aren't quick fixes or guaranteed ways to prevent kidney disease, but they are supported by well-established medical guidance and can make a meaningful difference over time. The first habit is one of the simplest: stay well hydrated. Your kidneys need water to help remove waste from your body. Drinking enough fluids supports this process. However, enough doesn't mean forcing yourself to drink excessive amounts. Your needs depend on your activity level, the weather, certain medications, and any medical conditions you may have. For example, some people with heart failure or advanced kidney disease are actually advised to limit their fluid intake. That's why it's always best to follow your healthcare provider's recommendations rather than a one-size-fits-all rule you might see online. A good goal for most healthy older adults is to drink regularly throughout the day instead of waiting until they feel very thirsty. As we age, our sense of thirst often becomes less reliable, making dehydration more common. The second habit is keeping blood pressure under control. High blood pressure is often called the silent killer because it may cause no noticeable symptoms while slowly damaging blood vessels throughout the body, including those inside the kidneys. If your healthcare provider has recommended monitoring your blood pressure at home, make it part of your routine. Pairing it with another daily habit like having your morning coffee or reading the newspaper can make it easier to remember. The third habit is managing blood sugar if you have diabetes or prediabetes. Even small improvements in blood sugar over time can help reduce stress on the kidneys. This doesn't require perfection. It means working with your healthcare team, taking medications as prescribed if needed, staying active, and choosing balanced meals most of the time. Speaking of meals, let's talk about food. There isn't one magical kidney diet that fits everyone, but many experts recommend a pattern of eating that includes plenty of vegetables, fruits, whole grains, beans, nuts, and healthy sources of protein, while limiting highly processed foods that are often high in sodium. Why? Does sodium matter? Too much sodium, commonly called salt, can contribute to high blood pressure and make the body hold on to extra fluid. That extra fluid can place additional strain on both the heart and the kidneys. A practical tip is to read nutrition labels. You may be surprised to discover that foods that don't taste especially salty, such as canned soups, packaged meals, sauces, deli meats, and some breakfast foods, can contain large amounts of sodium. Cooking more meals at home, when possible, gives you greater control over what goes into your food. Another habit that supports kidney health is staying physically active. You don't need to run marathons. Regular walking, gentle strength training, stretching, swimming, or cycling can help support healthy blood pressure, blood sugar, heart health, muscle strength, and balance, all of which indirectly benefit the kidneys. If you're just getting started, even 10 or 15 minutes of walking each day is a meaningful step. As always, if you have medical conditions or haven't exercised in a long time, discuss the safest approach with your healthcare provider before beginning a new exercise program. Here's something many people don't realize. Certain medications can affect the kidneys, especially when used frequently or in high doses. For example, common over-the-counter pain relievers known as NSAIDs, which include medicines like ibuprofen and naproxen, can increase the risk of kidney problems in some people, particularly older adults, those who are dehydrated, or those who already have kidney disease. This doesn't mean these medications are unsafe for everyone. It simply means they should be used as directed and discussed with your healthcare provider if you need them regularly. The same is true for herbal supplements. Many people assume that because something is natural, it's automatically safe. Unfortunately, that's not always the case. Some supplements can interact with medications or even harm the kidneys. Always let your healthcare provider know about every vitamin, supplement, and over-the-counter medication you take. That conversation can help prevent unexpected problems. Now let's discuss a few warning signs that should never be ignored. Seek prompt medical evaluation if you notice blood in your urine, severe or rapidly increasing swelling in your legs or feet, sudden difficulty breathing, especially if it's associated with swelling, very little or no urine despite drinking fluids, severe pain, fever, or symptoms suggesting a kidney infection, sudden confusion or extreme weakness. These symptoms do not always indicate kidney disease, but they can signal serious medical conditions that require timely care. For less urgent concerns such as persistent swelling, ongoing fatigue, changes in urination, or recurring itching, schedule an appointment with your healthcare provider rather than waiting to see if the symptoms disappear on their own. One of the most important messages from today's video is this: your feet may not tell the whole story, but they can start the conversation. They often reveal changes that deserve attention, whether those changes involve your kidneys, your heart, your circulation, your nerves, or another part of your health. Listening to your body doesn't mean assuming the worst. It means noticing changes, asking questions, and getting the right information before small problems become larger ones. Let's quickly review what we've learned today. We talked about why swollen feet and ankles can sometimes be an early clue that your kidneys are not managing fluid as efficiently as they should. We discussed persistent dry or itchy skin and why it can occasionally be linked to changes in kidney function. We explored numbness, tingling, slow healing wounds, and changes in urination symptoms that have many possible causes but deserve medical attention if they persist or occur together. We also looked at why diabetes and high blood pressure are two of the biggest risk factors for chronic kidney disease and why regular checkups become even more valuable as we get older. Finally, we covered practical habits that support kidney health, staying appropriately hydrated, managing blood pressure and blood sugar, eating a Balanced diet with less sodium, staying active, and using medications and supplements wisely. None of these habits can guarantee that kidney disease will never develop, but together they can support your overall health and may help reduce your risk of complications while improving your quality of life. Thank you for spending this time with me today. I hope this information helps you feel more informed and more confident about recognizing changes that are worth discussing with your healthcare provider. Before you go, I'd love to hear from you. How old are you and which country are you watching from? Have you ever noticed changes in your feet that turned out to have an unexpected cause? Share your experience in the comments below. Your story could help someone else recognize a symptom they shouldn't ignore. And if you found this video helpful, consider subscribing for more evidence-based videos on healthy aging, heart health, brain health, nutrition, mobility, and practical ways to stay active and independent for years to come. Until next time, take good care of yourself, pay attention to the small signals your body gives you, and remember that early awareness combined with regular medical care is one of the best tools we have for protecting our health as we age.